Good afternoon, everyone. I'm hoping everyone has had a good session thus far. As we continue with today's program, I have the pleasure of being able to introduce our moderator for this session, who is Ms. Tanya Elise. Ms. Tanya has a professional background in human resources. She has worked at the Library of Parliament since 2016, and her current role is an HR Systems Analyst. She holds a Bachelor of Degree in Business Administration from the Université de Québec en Montréal. I've been trying my French, so I hope that works. She is currently pursuing her master's degree in project management at the Université de Québec en Outaouais. Okay, I hope I got that.
Outaouais.
Ottawa. Oh, excuse me.
Outaouais.
There we go. Her hobby is knitting and crocheting, which she uses as a channel to provide Black girls and boys with dolls that reflect their image. As a bilingual English and French support person for SCOGO, Tanya supports the success of SCOGO's projects, like improving vaccine acceptance within sickle cell and Black communities, by providing English and French translation, as well as interacting with clients as needed. So I have the pleasure of handing it over to Tanya to moderate.
Thank you, Aika, and thank you everyone for joining this session. We will be starting with Cassandra Trimnell, will be our first presenter. I will introduce Cassandra and then she'll be able to start. So Cassandra will be talking about passion's role in health equity. Cassandra, just pardon a second. Won't be long. So Cassandra is the founder and executive director of Sickle Cell 101, SC101. You'll find it on social media. She's a patient advocate, speaker, and consultant. She holds a bachelor degree in global studies from Sonoma State University and Sickle Cell Educator Certificate issued by the Department of Public Health. That was in 2014. She's responsible for developing and creating the educational material and curricula presented by SC101. With over 50,000 followers in 115 countries, it is the largest social media presence dedicated solely to sickle cell disease and sickle cell trait research and education geared toward individuals living with sickle cell disease. Cassandra is a board member for the Global Alliance of Sickle Cell Disease Organizations and sits on committees within NIH, HHS, and other stakeholders within the sickle cell community. Our passion for sickle cell education and advocacy stems directly from her living with sickle cell disease, hemoglobin SS. So I will hand over to Cassandra, but right before I would just we'll just share if there's any disclose. So I think you can see my screen. Yes, go ahead, Cassandra. Back to you.
Can you hear me all right? Wonderful. Thank you so very much, first and foremost, for having me. I am so delighted to be a part of this event and to speak on health equity. It's, you know, just as someone living with sickle cell disease, it's something that's near and dear to our heart. Sickle cell is a beast. So, you know, how do you maintain a beast that's healthcare? And, you know, a lot of the times sickle cell patients fall within the cracks within healthcare. So I would like to cover, you know, what health equity looks like for patients and talk a little bit more about myself as an advocate and my organization, Sickle Cell 101, and what we're doing to help mitigate the disparities found in health. So just a little bit of background on myself. My name is Cassandra Trimnell. I'm executive director and founder at Sickle Cell 101. Sickle Cell 101 is a nonprofit organization based in Silicon Valley. I'm actually here in California. So I'll just use that as a disclaimer as well, because, you know, a lot of times when we talk about sickle cell, we talk about, you know, we have a US-centric lens on things. And we're trying to make sure that, especially with the work with Sickle Cell 101, that we have a global lens on a lot of this stuff. What happens here in the US isn't always reflected elsewhere. So that's my disclaimer. If I sound too American, y'all let me know. But essentially, Sickle Cell 101 is a nonprofit organization that specializes in sickle cell education. And we also work very, very hard to make sure that we are able to provide data and use data within the global sickle cell community to move progress forward and to, help determine what we disseminate on our platforms. And so we rely on the global sickle cell community to do so. To get started, health equity, what exactly is health equity? We often use the words equity and equality interchangeably. But what equity means is that we're not necessarily giving everybody the same treatment. We are giving the best treatment for that person. And so you'll find in sickle cell, at least here in the US, health disparities among Black patients is really, it's alarming at this point. And oftentimes it feels, with sickle cell, it feels that our healthcare is out of our control. And so I think it's important for us as patients to feel empowered when we are in clinical settings, when we are in the ER, when we are, in appointments with our healthcare providers, making sure that we are setting the stage for ourselves and making sure that we are in a position to get the best get the best care that we can. And so the question is, what is the patient's role in health equity? And to paint the picture in a fair and perfect world, this shouldn't be a burden for patients. We should be able to go into, the ER and get the best care and get care that is, that will help our circumstances, right? There's a lot of dialogue within the community on this, particularly how much should a patient do? How much can I do if I am in so much pain and I am coming in need of care? While I'm managing this pain, educating healthcare providers, this is sickle cell disease, I need this. This is, and directing that while I'm managing. So I say, in a perfect world, health equity isn't our burden, but of course we live in a very imperfect world. So how do we navigate within that world with the tools that we have? And it's essentially that, it's tools. And those tools are education. Those tools are self-advocacy. So with Sickle Cell 101, our mission is to make sure we have an informed patient population. We want to give you all the information you need to make the decisions best for your care. So that's really our mission behind our organization, and that's something that I stand behind as someone living with sickle cell disease. It is important for us to stay informed as possible, to make sure that we are receiving the care that we need to receive. So in this case, knowledge is power. And making sure that we are educated on what treatment options are available, what treatments look like, what is the difference between acute treatment and, ongoing treatment, what curative options are available, arming ourselves with what guidelines there are out there for people living with sickle cell disease to make sure that we are getting the best care and the appropriate care. And so to me, health equity and what it looks like for patients is making sure that patients are able to understand the disease, one, understand treatment options available to them, two, and understand how best to communicate and to navigate healthcare systems. This is a big ask. Don't get me wrong, this is not an easy thing to do. It honestly is a full-time job. But in order to seek the best care, this is what we kind of have to do in order to this is what we have to do in order to make sure to ensure the best care possible for people living with sickle cell disease. Please let me know if I'm going over time. I guess I will pause here and see if that is time. Tanya.
Yes, no, you still have some time if you want to share. I would like to remind also our participant that there's the Q&A box if you have questions as they're coming while our speakers are talking, but I will hand back to Cassandra. You still have about 3 minutes to go.
Okay, 3 minutes. Okay, so I guess the next thing I'd like to talk about is what I personally do to ensure the best care. I'm sorry, for myself. I think the first and foremost, there is such a small amount of specialists for sickle cell within this world. If you think of sickle cell in the global patient population, we're talking about millions of patients and a very, very tiny amount of specialists. Not all hematologists even specialize in sickle cell. So what do we do with that? We expand our horizons. And as a patient, I have made sure that I have found a healthcare provider that doesn't necessarily know the most about sickle cell, but cares enough for me to do the work, to understand the disease, to stay on top of medical advancements, to bring me new information, for me to bring them new information. It's a collaborative effort. And so first and foremost, my advice would be to make sure that you have a physician that you trust and that's willing to work with you to make sure that you have the best care possible. So that's my advice as someone living with sickle cell disease. I know here in the US, transition is a big deal. And a lot of kids cannot be transitioned to adult hematologists. And so you don't need to find a specialist, you just need to find somebody that cares enough for you and that's willing to put in the work for your care. It looks like I have 1 minute left or maybe less.
Yes, so 1 minute, we're almost there. So I don't know if you had one last thing to add, then I can go to the next speaker.
I think that's a good spot to end. Thank you, Tanya.
Thank you, Cassandra, for sharing that experience and what you're doing, propaging this on social media. Our next speaker is Fitzen Awell. So Fitzen was diagnosed at 5 months old with sickle cell disease. For everyone around her posed as an issue, but for Fitzen, she learned that it was an obstacle to overcome. Running a business while having sickle cell disease may be a lot for many people, even for those without sickle cell disease. But Fitzen faced the challenge head-on. Her business ventures have provided her with some of the greatest lessons in life and shaped her in a new and exciting way. Fitzen's determination and resilience stem from the strength provided by dealing with sickle cell disease. Currently, she's the deputy chair of the SCAGO's Patient Advisory and Advocacy Council, the PAC, and she's completing her training to become a registered massage therapist. So now back to you, Fitzen.
Everyone can see me and hear me well before I start speaking. Hi, everyone. Thank you for taking time out of your busy days and coming and listening to our stories and being educated with us. We thank you for your time. Thank you, Tanya, for that beautiful introduction. So I'm gonna go ahead and share my slides first. Okay, so I will be speaking on the patient's role in the promotion of health equity. So this was a presentation that was composed of work between myself and other members of PAC, including Tanya and Lanre, as well as Lance. So first, before we even talk about health equity, we have to, and how to properly get equity, we need to talk about what is health equity. So it is ensuring that everyone gets the healthcare that is right for them. So it is providing the most fitting opportunities for people, regardless of their gender, their ethnicity, their socioeconomic status, whatever, everything that makes us different in life. It is basically making sure that we all have equal access, equal opportunity to fair and necessary healthcare, essentially. It involves optimizing health in a fair way. Health equity reduces health disparities by improving the health and the economical or socially disadvantaged, not by a worsening of the health of advantaged groups. So promoting health equity is consistent with social justice and should reflect the respect of human rights. Public healthcare workers have the obligation to promote health equity, and health equity requires concerted effort to achieve more rapid improvements, particularly for members of disenfranchised groups. So essentially, health equity is just making sure that regardless of race, regardless of gender, biases, whatever may come about, whatever you may present with, or whatever makes us different, essentially, that we all are getting equal opportunity to healthcare. So especially for sickle cell, it's one of the biggest factors that determine whether or not, I know for me, whether or not I end up going to even emergency when I'm sick. So based off the current quality of care in Ontario, for persons living with sickle cell disease, we may not have access to comprehensive care, including knowledgeable care providers, which is one of the biggest things that I've noticed. Maybe we may also be stigmatized, and we see this a lot, we hear this a lot, stigmatized as drug seeking, and denied access to effective pain medications when presenting for medical treatment for severe pain crisis, especially in the emergency department. We may be left in the emergency department for hours in hallways or on even in the waiting rooms in agonizing pain without appropriate analgesia or pain medication or care or even water. And It may also, depending on the hospital administration, we may also receive suboptimal care and treatment resulting in preventable complications and even premature death. So this is actually my story. So being that I've lived with it for 29-ish plus years now, I've experienced so much stigmatism from healthcare practitioners. I've gone into hospitals where they've turned me away. I think the earliest story that I have, unfortunately, was when I was first diagnosed. I was 5 months old. My mom took me to the hospital that's closest to where we live, and they told her to never bring me back. They put me on an ambulance and they sent me to Sickets, which is, if you live in Ontario, if you live in Toronto, and you know driving from the east to downtown is not a great experience. It's over a 35-minute drive on good days. So that's something that we experience often, and no matter how far we get and how much advocating we do, it doesn't seem to change very often. So I find that my worst experiences are always in the emergency department, especially because the doctors are on rotation. They don't usually know your care plan or what your care team has set in place for you. So you always get less than sufficient care in the emergency department. And it's very disappointing and it's very sad that we have one of the most prevalent genetic blood disorders in the world, and we get the most mistreatment, where as someone with cancer or anyone else, lupus, any other disease, they don't experience what we experience, and it's super sad. So this is why I am grateful to be deputy chair of PAC, because with that, I'm going to use my voice and my place to make sure that this changes from here on out. So what we expect for the quality of care in Ontario is that we are triaged within 30 minutes. We receive an IV of opioid analgesias within an hour of presenting into the emergency department. We are triaged at CTAS 1 or 2. So depending on what we present with and how severe the crisis may be. We receive respectful and patient-centered, empathetic and compassionate care. So it's not only about, oh, let's give them pain meds and get them out the door. It's also how you are as a person. Are you personable? Are you warm? Are you welcoming when I'm in your emergency department? We want to receive non-pharmaceutical pain management as well when necessary. So not just opioids, of course, we're already labeled as drug seekers, but if we could get into physiotherapy or anything along any form of therapy, I guess, that would also be beneficial to our healthcare. Why not? Receive active hydration, whether it be oral or IV, and oxygen as well, and receive proper discharge, formal outpatient follow-ups with the medical team and that specializes in sickle cell disease, and a prescription for adequate supply of effective analgesias until the next medical appointment, which is very hard to find. So accountability as a driver of healthcare, of health equity, excuse me. So the Ministry of Health should set up a reporting system in the hospitals. This is what we feel would help change or better aid our healthcare as those with sickle cell disease. So patients with sickle cell disease should be informed on their right to report on their experience to the MOH. So it doesn't matter what hospital we go to, we should always know our rights as a patient, but we should also know that whomever is in charge, if we receive suboptimal care or less than, we should know that we have the right to report it, and we shouldn't be stigmatized for reporting it as well. Healthcare providers should receive incentives and or penalties for compliance or non-compliance with meeting key critical care quality metrics. So once they are following the care plan or not, there should be some form of incentive, I guess, to force them to better.
Looks like Fitzan is frozen. Okay, we hope she will get back to us soon. Tia, if you're ready, we can start with you. So Fitzan is back.
Are you
Hello,
hearing me now?
Fitzan? Yes, we are.
Okay.
So you have about 1 minute left, and
Okay.
then we can jump to Tia.
Okay, so as a patient, there are a lot that we could do to advocate for ourselves as well. We just want to make sure that we are advocating to our full abilities. And this is why we have things such as PAC. So PAC was started in December 2020. Are you still hearing me?
Yes, we do.
Okay, I just wanted to make sure. And it's an organization composed of healthcare providers, patients, and caregivers that help to advocate for those with sickle cell disease. So our purpose is to advocate, of course, help identify any gaps in the healthcare system, to serve as advocates for those that may be impacted, whether it be the patients or the caregivers as well, and to work with hospitals and to help change. Because the one thing we want to do, especially with things like today, is invoke change and make sure that we're changing for the better. So this is just a list of achievements that we've been able to accomplish in the last year or so. We've contributed to Bill 225. We've helped report to studies where we've helped with educational sessions. We've met with St. Joseph hospitals to help contribute to different educational programs. So you can see that we are very active in our role as PAC members, and we just want to continue to make sure that we're advocating not only for those that don't know how to, but we're also teaching those how to advocate for themselves and working directly with the hospitals to ensure that there's change. So I will stop sharing.
Thank you, Fitzan. Thank you especially for sharing your personal experience. As you said, was not easy, but thanks to PAC, to SCAGO, to everyone advocating for health equity, we're sure we're getting somewhere. So thank you again. Now I will be introducing Tia Campbell, who's our next speaker. So Tia is a Canadian born to parents who migrated from the Caribbean island of Jamaica. Tia was diagnosed with sickle cell disease at the age of 2. Growing up, she experienced the positive and negative attributes of living with sickle cell anemia. She was told that she was lucky to be living past 25 years and that she will not be able to have children. However, she beat both predictions and gave birth in 2014. Congratulations. Tia has a diploma in social service work, a bachelor's in criminal justice, and over 7 years of experience in social work. She's the social worker and a member of the Patient Advisory and Advocacy Council of the Sickle Cell Awareness Group of Ontario, SCAGO. And Tia today will be talking about the educational and professional achievements of people living with sickle cell. So back to you, Tia.
Thank you so much for that, Tanya. Can everyone hear me just before I speak?
Yes.
Okay, perfect. So I just want to say thank you for having me today as well. This opportunity is definitely fulfilling. Um, just to be a part of SCAGO and to be here to talk about, the equity, the health desires that we all want to achieve. I too am a patient living with sickle cell. As Tanya mentioned, I was diagnosed at 2 years old. So I would just like to address a few of my experiences, both the present and past. So as a young Canadian born, my childhood experience was more on the negative side. I have always been an outgoing individual, as as young as ever. However, I encountered a lot. And when I say a lot, I mean I went through a lot of pain. I can't even count on one hand or two hands how many physicians I've met or how many times I was hospitalized. It was a struggle. It was a struggle because I myself did not know that being a patient of sickle cell would mean that I had a disability or I had a disease, right? When you're young, you just want to play. You want to feel normal. You want to do what everybody else is doing. And unfortunately, that was just not the case for me. The only advocacy that I had was my grandparents and my parents. I was fortunate to have parents who were working, but then I was unfortunate at the same time because at a young age, I could see the toll that my crisis would take on them. Um, we didn't have any knowledge of the resources that was available to us. So when we speak of social assistance, such as Ontario Disability Support Program, my parents didn't know anything about that, right? So that was another challenge, and that was something that was disclosed to me a couple of years back when my mom said to me that you're actually lucky to have the knowledge that you have now because we weren't told much when we learned about what sickle cell is. All we were told was, okay, this is the kind of medication that should be provided. This is what she needs to be taking. Um, and of course, they're going to accept anything that they're being told because they just want to see me happy. They want to see me run. They want to see me jump. They want to see me play. And moving forward from that, even in my high school days, as I learned who I was as an individual living with sickle cell, it became more challenging mentally for me because when I would share it with peers or with the parents of peers that I would be close with, I heard my discrimination. I faced bias, right? Like, oh, I heard that sickle cell kills people at an early age, and you're not going to live to see past 25, or you're not going to be able to have any children. And that was hurtful. That was hurtful because in your teens, you start to think about marriage. You start to think about having a boyfriend or having a girlfriend, and you want to be a part of the sports team. And no matter what I did, every time I fell into a crisis, I had to explain to the educators that I have, even in elementary school and in high school, what sickle cell was. Why does it affect me? How come I even have it? And even though I knew that, because at the time I do have a sibling, and I even though I knew that I was the only one with it, I couldn't really answer these questions because I was just not interested in learning what sickle cell is and what it does. I just knew that I was the lucky one to have this disease, and to me it wasn't fair. So I just said, you know what, I don't even want to discuss it anymore. I don't want to share it with anybody anymore because when I do mention it, everyone looks at me like, what's that? Why do you have that? Like the lack of knowledge was really present. It was really present, and it was mostly hurtful. It was hurtful because, you know, even the expressions that you see on individuals' faces was enough to just let you know that maybe you don't matter, or maybe your sickness is like it's like maybe a joke to them, like, or and I became a joke. As a matter of fact, I became a joke myself because when I would feel sick, I would try not to limp, during sports, or trying to just have fun playing with peers, that they would say, "Oh, she can't walk again," and it became so challenging that I wouldn't even want to discuss it. So when doctors would ask me questions like, oh, we have a counselor that you can speak to or a social worker that you can speak to, I declined most of the time because I said to myself, what am I going to say? That I need more medication again? And start and even going into the hospital and emerge at such a, I wouldn't say young age, but I would say like at between the ages of 15 to 20 years old, I faced discrimination. I faced discrimination. It was hard for me to get letters to present to my educators as to why I was sick, and how long I was in the hospital for. And I had, good thing I still had, you know, doctors who were on my side who went above and beyond to advocate for me. And speaking of the word advocacy, I didn't understand how to advocate for myself until I entered post-secondary school. So as Tanya mentioned, I started off with social service work, and it wasn't until my attendance in social service work that I learned about the interpersonal skills. And so that gave me the opportunity to understand who I was, how to accept who I was, and therefore accept others, because sickle cell at the time, and still to this day, is not the only disability or disease that's out there, as we all know. So it gave me the mental space to be free, to understand that even though I have this sickness, even though I have this disease, I am still a human being. I am still a person who deserves to achieve her goals. And I became determined. I slowly became determined because after being in school for 2 years and being on the honors roll, I said, I'm not going to stop here. I will refuse to stop here. I need to keep going. And that's when I decided to, because I've always was interested in law. And I said, you know what? I need to apply for the criminal justice program. And so when I applied for the criminal justice program, not only did I understand what it meant to be a part of community development, but I understood what human rights were. I understood what our rights were in the healthcare system. I understood just the entire system on the whole, and understanding a lot of behavior with evidence-based approaches, right? And so understanding who I was led me to understand the behaviors of others. And when I mean others, I don't mean like individuals who are coming out of the criminal justice system or individuals who are homeless. I mean individuals who are also in the healthcare system, professionals on a whole. And I understood then, I started to learn to understand then that professionals too have to give everyone the same equal treatment. It does not matter what the face of the disability is and what level of pain that person is going through, or how that person may look, whether they can walk, whether they can't walk and they're in a wheelchair. We all deserve the same treatment. When we walk into an emerge, be rushed into emerge, and need the empathetic treatment in emerge. And so along the way, I gained my power, right? I didn't know what empowerment was, and I didn't understand what power was until I was in my third year of criminal justice, because I learned then that even though we have to pay attention to how we're being treated in all the systems overall, even the social sector system, we have to understand that in order to achieve our rights, we have to advocate for ourselves. Because I learned then that the empowerment that we have within ourselves will lead to the advocacy, will lead to self-advocacy, my apologies. And so therefore, I found the strength and the wisdom and the knowledge and the power again to start applying for employment, because I was under the impression that I'm a Black woman, I have a disability, and if all these educators could judge me, what if I face judgment again when applying for jobs? I was fortunate to find employment within 4 months of graduating. And I was also empowered to start my first job within a youth homeless shelter. And working with youth was so empowering, and it was so empowering for me myself. I came across youth who had the sickle cell trait and who were homeless and who were not able to achieve employment. And that was hurtful. And it was hurtful for me because I had experienced some of what they experienced. But it was also rewarding because I was able to guide them by sharing with them what I did to keep pushing forward. Unfortunately, I also came across my first discrimination from an employer. So I fell sick because my sickle cell interfered with my eyesight. And because it interfered with my eyesight, I had to immediately have a day surgery the next day. And I was told that I cannot work for 6 months. I actually went back to the employment that I was working at because the hospital that I went to was just down the street, and I was asked to see every single paperwork ever, not knowing that at the time you do not need to show a doctor's note, you do not need to disclose your personal health information. But I was desperate to keep this job. Am I over my time, Tanya? Sorry.
But it's so interesting, and I think people
Oh,
still want to listen.
okay.
We do not have a lot of questions. I just wanted to remind people as well that we have the Q&A box if they have questions, but we still have 6 minutes left to the
Okay.
session. So, but yeah, for your time, it's over. But if there's still time, I invite Fitzan and Cassandra as well to turn the cam on. If there's anything they would like to add, meanwhile, we're waiting for questions.
Okay. My apologies, sorry.
No problem. That's what happened when you share about something that you're passionate about and, you know, going through yourself. So I think we can all relate to that. Thank you. So first of all, I really wanted to thank you, the three of you, taking the time to share on your personal experience, on your personal level, for others to understand why equity in health is so important. As we said, we are the first advocates for our situations. Even Tia, talking about education and professional striving, said the same, that we need to advocate for ourselves. So I would have a question for Cassandra. What triggered you to start with advocating on that, going outside on social media?
Yeah, thank you. Just wanting to learn more about the disease that I live with. I thought I knew a lot about sickle cell. I thought I was pretty informed growing up, but then I realized how much I didn't know. And I thought if I didn't know X amount, how many other people don't? And at the social media was the way to get to find a community, to get messages out to more people. And so we used that as an avenue. It was Instagram at the time, back in 2012, 2013, and Instagram was the big platform. And I said, if I didn't know this, and I was a bio major at the time, if I didn't know this, how many other people don't know this? And so just wanted to make sure by keeping myself informed and making sure that information is, going to that statement, each one teach one, right? Always, share information out, whatever's useful, conversations like this, forums like this, where we can share tips and share experiences, always makes us more informed as a community. And so social media was the way that we did that. And that's what we continue to do, and we'll continue to do moving forward, because it really is meeting people where they're at.
Thank you, Cassandra. My next question will be to Fitzan. What would you, like for someone who's a regular person that is not involved in an organization, because you said you joined the PAC, for example, to make sure that you can advocate there, but a regular person, what would be your advice if they feel like they want to do something to advance equity or yeah, the CSR cause?
That is a great question. And it's funny, I have a lot of friends that ask me this all the time. They're not sick. They're like, what's the best thing that I could do? The first thing I tell them to do is get educated. Because when I say I have sickle cell, I guess, Cassandra, you've probably gotten this. Thea, you've probably gotten this too. What is that? Okay. And they like step back because they think it's contagious, or they freak out because they don't really understand it. But I know for me, I would say start by getting educated. If you don't know what it is, you're not going to know what to advocate for. That's one. Two, get involved, even if it's going to SCIGO meetings, joining a summit just to hear and listen and learn. Always start there. It's a good starting off point, because how are you going to advocate if you don't know what the community looks like? Because although I guess we're all stigmatized because of race, we're all the same skin color, we're all the same race. There are people in the community that are not, they don't look like me, they don't look like Cassandra, they don't look like Thea. I've met people from Southeast Asia with sickle cell. So it's kind of like get exposed to the community, know who's out there, understand who's out there, and then get involved. Volunteer one day with the summit, volunteer at one of the Learning for Life sessions that SCIGO has. Reach out to PAC and see what they're doing for the hospitals. And if you don't want to start on that level, I mean, if you have somebody that you know that has sickle cell, go with them to a hospital visit. If that doesn't, if you don't want to get involved on such a big platform, go with them to the ER. It'll give you a reason to want to advocate for them, if anything. So that's my number 3 tips on getting started.
Thank you so much, Fitzan. We would like to stay and share and keep talking on and on, but the closing remark has already started, so I would invite everyone to join back to the main lobby and join the closing remark by Mrs. Lanri Tujiajai, the President and CEO of SCIGO. So once again, thank you everyone for attending, and have a nice day.